Good morning, everyone. Good morning for the people who are watching us through our social media. Remember, if you want, you can join us here at the Academy, or you can watch through YouTube, our YouTube channel, or on Instagram. So today in our Academy Treatment Plan Seminar and Literature Review, I'm going to talk about early versus delayed implant placement. And I am going to give you some specific guidelines to help you figure out when to place an implant. So, as always, it's important for me to say that we work here at International Advanced Dentistry as a team, and it's important that all departments we work in perfect harmony. So, it's important not only for the implant dentistry department, but also for the prosthodontics, the oral hygiene. Everybody needs to understand when we should place an implant. But we start our journey at full speed, but there's always a question that I do to myself, and it's important sometimes for us to stop a little bit. And we have to think also. And why do we need to think? We need to think because in order for us to know exactly when to place an implant, there's a question that we must understand and we must have the answer. What happens in the alveolar socket after tooth extraction? So for this, and this is my introduction, I would like first to tell you about this article that I have here. It's by Mauricio Araújo in 2015, and it explains a little bit what happens around the alveolar socket in terms of anatomic changes and also in terms of histology. So we know that in current dentistry, there's a lot of discussion, a lot of studies regarding this subject, because when we extract a tooth, we know that it's going to occur a volumetric change. And there is going to be some stuff around the hard tissue and around the soft tissue. What I can tell you is, for instance, up to 50% reduction will occur in the original ridge. We know that is going to occur some bone reabsorption that is higher in the buccal place than in the lingual palatal place. And we know that in the areas, posterior areas, the bone reduction, it will be higher. And we know that the organization of the alveolar ridge can be up to one year of post extraction, and we know that this occurs when we see in the radiology that the socket is filled with bone, or when we see the fully epithelialization of the soft tissue. So, talking a little bit about the histological phenomena that are going to occur in the alveolar socket, we have then the first phase that it's called the inflammatory phase. And this one is going to divide between two phases. We have the blood clot formation, and we have also the inflammatory cell migration. So, we extract the tooth, and then it starts to bleed a lot. But then there's going to be a blood clot that is going to plug the severed vessels, and it's going to stop the bleeding. Then, within the 2-3 days that are after the surgery, we know there are going to be inflammatory cells that are going to start to clean the wound, and afterwards there are going to be also vascular sprouts and immature fibroblast cells that are going to form the granulation tissue. This granulation tissue is then going to sterilize the wound, and we're going to have a provisional connective tissue matrix that is full of collagen fibers and other types of cells. Then we enter to the second phase, which is characterized with an intense and rapid tissue formation, and it is called the proliferative phase. It's also divided into specific phases that it's called the fibroplasia and the oven bone formation. Fibroplasia is characterized by the rapid deposition of a provisional matrix that then is going to be penetrated by vessels and bone-forming cells. And then we have finger-like projections of oven bone that are going to lay down into the vessels. Then, within the 2 weeks, we start to see the oven bone formation, which is a provisional type of bone without any load-bearing capacity. So this then is going to be changed, and it's going to be mature bone. And that is going to occur in the third phase and last phase. It's important for me to say also that it's all sequential, but frequently they overlap between each other. So the last phase that we have in the socket healing process, it's called the modeling and remodeling phase. So we have the modeling phase that it's characterized by the change of the shape and architecture of the bone. And we know that 2/3 of this modeling process will occur in the first 3 months of healing. But we know also that it's going to be a bit different between the buccal side and between the lingual or palate side, because the buccal side has a little bit more vertical bone loss when we compare to the lingual or palatal side. And then after several months, we start to have the replacement of oven bone by mature bone, so lamellar bone or bone marrow. But it's important for me to say that it's going to be different in each type of individual. This is not every individual has the same amount of months for this to appear. So we can define this third and last phase as the reduction of dimensions in the ridge. And of course that this is crucial for us to know, because when we want to place an implant, we want to place it in a prosthodontically driven position. So we must understand what happens around the alveolar socket. And that's why I did this small introduction for you to understand what is going to happen in different days, in different months. So then I start with the guidelines of early and delayed implant placement. I have here two articles that I'm going to talk throughout the seminar. The first one is by Daniel Boozer, written in 2016, and the other one is by Stefan Chen, that was written in 2014. So we know that in the first 25 years of implant dentistry, the places that we placed implant were healed sites of fully edentulous patients. And that has already changed and completely different type of dominance. Because if we tell a patient that we are just going to place an implant after 6 months, of course, he's not going to enjoy this discussion. So we must understand exactly when we can place the implant. And of course, timing of the implant placement has become a very important issue. So what happened is that the ITI in the two consensus conferences 2003 and 2008, they defined four types of when we could place the implant. The first one is the immediate implant placement, that it's at the day of when we extract the tooth. Then we have the type 2, that it's early implant placement, that it's going to be between 4 and 8 weeks. We also have another early implant placement that it's between 12 and 16 weeks. And then we have the last one, which is the delayed one, that it's of 6 months or more than that. When I first studied this division, I saw that were two types that were called early implant placement. And I was a bit confused because, well, why are they called exactly the same? But the truth is that they are totally different, because when we are talking about type 2, we know that it's related to soft tissue healing. And when we are talking about this type 3, we are talking about already partial bone healing. So these are completely different. So now we started our journey at full speed, but we have four different paths to choose. Which type am I going to choose? When am I going to place the implant? So it's important for us to know that these four types of implant placement, of early implant placement, it was developed in the late 90s, and it has a lot of beneficial. Of course, that we are not going to do an immediate implant placement. It's better for us to wait a little bit and then we place it. So the both articles that I've here, they will say that this approach is well documented in the recent years. We know that there's a low risk of mucosal recession. For aesthetic cases, this is crucial. Good to excellent aesthetic outcomes. And they even say facial bone wall thickness of approximately 2 millimeters is shown after 6 and 9 years of follow-up in CBCT imaging. So talking about the third type that we have, the partial bone healing, that it's between the 12 weeks and 16 weeks. It's used when we need a slightly prolonged socket healing period for us to have new bone formation, mainly in the apical area. We use it when we have extended periapical bone lesions that it's present and it doesn't allow primer stability. And it's very used when we want to use when in multiple rooted teeth, for example, the mandibular first molars. Now talking a little bit about the late implant placement, we know that it's between 6 months or more than that. We use them mainly for young adolescents. For example, if a patient loses his tooth when he's 16 years old, we are not going to place an implant for sure. So we need to wait a little bit longer. Pregnant patients also we use because we need to wait after she has the baby. Also, for patients that are not available, for example, patients that work abroad or patients that are here for dental tourism and it's not available, it's also an example. Large apical bone lesions is also a good idea. The ITI strongly recommends to perform a socket grafting because they tell us to do this because we need to reduce the range alterations and of course the range atrophy. So in terms of conclusion, I brought here this table that has everything summarized what I've just told you. I hope that these guidelines helped a little bit to understand when we should place the implant. And I hope that you enjoyed this seminar and to see you next week. Thank you very much.